Talk Live, a health show brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It is sponsored by V-Care Home Health, a leader in providing home health services throughout the entire DFW Metroplex. My name is Dr. Samir Nangia, and I will be co-hosting today's show with my partner, Dr. Vik Prakash. You can watch us on our Facebook page, and after the show, head on over to our YouTube channel, Doc Talk Live, and like, comment, and subscribe to see great shows we've scheduled in the upcoming weeks. You can also ask your questions for today's show on Facebook Live as well. Again, more details can be found on our website, doctalklive.com, and if you're a healthcare professional and would like to be on the show, please send us a request through our website or through the Doc Talk Live Facebook page.
Hey DFW, this is Dr. Vik Prakash, your co-host of Doc Talk Live. Today we've got a great show for you. Back from popular demand with the topic we did last year, we're going to discuss Mommy Makeover today. Joining us will be Dr. Gbulie. And it's common knowledge that pregnancy often brings immense changes to a woman's body. And while many women choose to diet and exercise after pregnancy, some may find that no amount of time spent at the gym will really help get rid of sagging skin or pockets of fat. So there's a growing interest in mommy makeovers, which reflects an increase in pregnancies at later ages and increased multiple births in a generation of women with a keen interest in nutrition, fitness, and a continued desire to retain that youthful figure. In this episode, we'd like to bring you more information on the topic. So to be part of the conversation, give us a call. Numbers to the studio is 972-235-5555. Again, that number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Gbulie, welcome to Doc Talk Live. Thank you so much for your time to be on the show, and tell our listeners a little bit about yourself.
Well, thank you for having me. My name is Dr. Gbulie. I come to you by way of Mansfield, Texas, where I have my practice by the name of Posh PRS, Posh Plastic and Reconstructive Surgery. You can find me also on Facebook, and my website is www.poshprs.com. I'm a board-certified plastic and reconstructive surgeon, and I've been in practice for about 6 years now, and I've relocated from Memphis, Tennessee to the Dallas DFW area, and offering a full line of plastic and reconstructive surgery techniques. And thank you for having me.
Thanks again so much for taking the time to be on our show.
Absolutely.
This is our second show on this popular topic, so I want to remind everyone, please call us at 972-235-5555, or you can go on our Facebook page and enter your questions there. Again, last time we didn't get to everyone's questions, so today we're going to take another attempt at that. So our first question is, as we know, Mommy Makeover is a combination of procedures. It is a cosmetic surgery or a reconstructive surgery. And what is the difference between cosmetic surgery and reconstructive surgery?
That's an excellent question. So basically, by definition, is really who's paying for it. So your insurance company is going to pay for anything that is deemed to be medically necessary, which is the realm of reconstructive surgery. Now, anything that is being done just in terms of improving appearance, though you could argue that it does have health benefits such as psychosocial, like body image benefits, is really viewed as cosmetic surgery, which is an out-of-pocket expense.
Dr. Gbulie, what are the different options for a mommy makeover?
Well, mommy makeover basically is a loosely applied term that is used to describe anything, any kind of surgery that is used to restore youth in pregnancy and after delivery. The changes that go on typically occur in the breasts and the belly area. So mommy makeover is just a conglomerate of different things that different techniques that allow you to rejuvenate your body after you're done having children. Now, that being said, there's no one size fits all approach, because everybody's kind of sort of different, because everybody's body structure is different. So in terms of rejuvenating the breast, some people might need a breast augmentation, others might need a breast lift, while some might actually need both. And in terms of the abdominal area, it's usually some sort of contouring, such as a liposuction, a tummy tuck, or some sort of a combination of both. And those are all referred to as a mommy makeover. In fact, in some cases, some people do want booty augmentation as part of that as well.
For those who are just joining in, you're listening to Doc Talk Live. We're live in studios with plastic surgeon Dr. Gbulie, and we're discussing Mommy Makeover. So if you have a question, the number to the studio is 972-235-5555. Again, 235-5555. Dr. Gbulie, what are the options to get rid of those stretch marks after pregnancy?
Well, the stretch marks occur basically, obviously, from the baby growing and stretching out the skin, and also from the hormonal changes. Now, after delivery, it does take up to about 6 months for those changes to at least stabilize. And then, especially after multiple pregnancies, you do have stretched out skin and laxity of the abdominal wall. So again, using the no one-size-fits-all approach, it would then depend on what the presentation of that particular patient is. So some people would need to have their abdominal wall fascia tightened, which is part of a tummy tuck procedure, as well as removal of the excess skin. Now, excess skin can be removed as a mini tummy tuck, where you're not moving the belly button, or as a full tummy tuck, where you're actually moving and restoring the natural position of the belly button, as well as tightening the abdominal wall. And that would allow you to get rid of the stretch mark.
We've got a live call. Hey, you're on the air. What's your question for our expert today?
That's an excellent question, and it's one that I've come across quite a bit. So by definition, diastasis is separation of the rectus muscles, which are the muscles in front of the belly wall. And when that happens, and has already happened, unfortunately, exercise doesn't fix that, because exercise is not going to reposition the belly wall muscles. Usually some sort of a tummy tuck procedure would be what would be required to take care of that. Now, obviously, you did say that you've had only one child, so depending on whether you're still planning to have more children, usually if you're going to think about doing some sort of abdominal contouring like a tummy tuck, which would address that, then you may want to wait till you're done with your pregnancies. If not, it could stretch out again.
Folks, you're listening to Doc Talk Live, and we have in studio with us Dr. Gbulie. He's a plastic surgeon, and we're discussing mommy makeovers. So if it's something you've ever even thought about, this is your opportunity to get your questions answered. Dr. Gbulie, can you tell us a little bit more about the tummy tuck procedure or abdominoplasty? What's the recovery time? Is it painful?
I'd love to say that it's not painful, but that there is some degree of pain. We do have better techniques now where we can actually use some longer lasting anesthetics to help with the post-operative pain. So the tummy tuck basically means you're going to remove all the excess skin, you're going to reposition the belly button, put it back to a more normal position, and then with that, sometimes you do add some liposuction, and you definitely want to tighten the belly wall and give more than hourglass shape result. Now, the recovery depends on how much you've done. Usually, I tell my patients the biggest hit is in the first week. You will need to use some kind of compression garment. Because of the belly wall tightening, I will not let you lift anything heavy for up to 6 weeks, kind of like if you had a hernia repair. But usually by the second week, most patients are feeling more like themselves and back to being fully active. And as with most cosmetic surgery, the final result really takes months to show up, but most patients are really happy.
You're listening to Doc Talk Live. We're live in studios with plastic surgeon discussing Mommy Makeover Part 2. So if you have a question, the number to studio is 972-235-5555. Again, it's 972-235-5555. Also, head on over to our Facebook page where you can also ask your questions as well. A lot of us have heard about liposuction. We're a little bit more familiar with that. What's the benefits of liposuction?
Well, liposuction is a technique that was actually quote-unquote given to us by the French. It basically is a technique where you can thin the stubborn areas of fat that are not responsive to dieting and exercise, and unfortunately that can tend to become a now. Liposuction, as a disclaimer, is not designed for generalized weight loss or addressing multiple large areas. However, when a patient has stubborn areas that they can't just address by diet and exercise, then that's the major advantage of liposuction. It typically involves injecting what's called a tumescent fluid, and that helps break up the fat, and then you suction it out. Liposuction itself is not complete unless you also do what's called post-op massage and post-op compression to get the best results, and that again takes months for you to get the result, but most people are typically happy.
What parts of the body do you find that most people like to have liposuction?
Liposuction is most commonly usually in the truncal area, so basically in the front of the stomach, the sides, the flanks as well, because by doing that you flatten the contour of the front, and then you thin in the contour of the sides, and gives you the hourglass shape. And in this day and age, of course, you can't talk about liposuction without talking about the Brazilian butt lift, which is the fat transfer procedure where we take the quote-unquote excess fat from these areas and we process the fat and we transfer it to the buttock area to give you an augmented effect.
In general, Dr. Gbulie, what's the recovery period for most of these procedures, and how long does it take to get back to a pre-pregnancy appearance?
Really, since there's no one size fits all, really depends on how much of the mommy makeover you end up doing. As a general rule, most results will take in the region of 3 to 6 months, but like I said earlier, most people will start feeling more like the normal stuff after the first week.
For those who just tuned in, you're listening to Doc Talk Live. We're live in studios with plastic surgeon discussing mommy makeover. And the number to the studio is 972-235-5555. You know, we've been talking a lot about females. What about the male population listening?
Well, they're not mommies for that. So, but yes, that clearly is a role for plastic surgery in the male population. And, you know, I'm not ratting on my boys or anything, but there are a lot of men that get in liposuction, and I don't see anything wrong with it. Usually it's for getting rid of that excess fat in the belly area, and just there are also men that get tummy tucks if they have excess skin as well, especially with a weight loss population. So plastic surgery is also good for them.
Let's take another live call. Hi, you're on the air at Doc Talk. What's your question? Go ahead.
Well, a hernia is actually in the realm of a reconstructive procedure because a hernia is a medical problem. For you to, it sounds like what you need to do is to speak with a physician who is willing to take care of that. Usually most hernias are taken care of by general surgeons. And if you have a physician here who's willing to say that they will be taking care of that when she comes over here, that might form the basis of a medical visa.
Great. Again, the number to the studio is 972-235-5555.
We have another caller. Hey, you're on the air.
That's a really difficult question to answer because a lipo 360 and all the other procedures you mentioned, the mini tummy tuck and the breast augmentation, that really depends on the patient's body habits, and there's some folks where you actually will not be able to have all that done as one procedure. I really hate to say it, but it's hard to kind of like give you a quote for that without knowing how much we're going to be doing, whether we're doing it on general anesthesia versus doing it on the local. Since we're going to be doing the breast portion, you would need general anesthesia. So this is something you really need an in-person evaluation for.
Great, and he can be found in Mansfield. So we're about to head into the break. Again, the number is 972-235-5555, and we'll take your questions off air as well as we'll continue to take it on Facebook. And then we'll be back in 5 minutes for the second part of our show. Thank you for listening. You're listening to Doc Talk Live.